Hey everyone, first of all, like a big thank you for joining in. I am Gayatri and I'm so glad we are doing a session because let's be honest, conversations, especially about women's sexual health, don't happen often enough. And we all have questions about our bodies, about our health, and the changes we go through. But somehow along the way, we were taught to just deal with it, rather than talk about it. So, the moment where you're just standing in front of a mirror and you're trying to figure out, oh, why your body feels off, why you're more tired than usual, why your mood is all over the place, or why something just doesn't feels right, You tell yourself it's probably nothing, just maybe just stress, maybe just a phase, and you push through, hoping it'll just sort itself out. But here's a real tea. Our sexual health isn't some mysterious code we're supposed to suffer through in silence. And yet, for so many of us, it is a reality. And to the fact we have numbers that speak to us. India sees nearly 40 million cases of reproductive tract infections like RTIs and sexually transmitted diseases, STDs, every year. And yet, most of these cases go unspoken, untreated, and unnoticed. Maybe why do we think that way? Because we've been taught to stay silent. We've been raised to believe that discomfort during sex is normal, that irregular periods are just part of life, and that asking too many questions about your bodies is shameful. So we ignore that itching, the pain, the exhaustion, telling ourselves it's just stress or something that will pass. But truth is that our bodies are constantly communicating with us. That unexplained fatigue, those sudden mood swings, that pain you keep brushing aside, it's not just in your head, it's a sign that something needs attention. And that's exactly where we are heading today, to have the conversation we should have had a long time ago. So this Women's Day, we're putting ourselves first, and to help us do that, we have Dr. Shweta Shah. Dr. Shweta Shah is a gynecologist and obstetrician based out of Bombay with over 10 years of experience in women's health. She works with everything from high risk pregnancies and fertility treatment to advanced laparoscopic procedures. Now, what sets her apart is her patient first approach. She believes in keeping things very simple, clear, and stigma free. She's not about big medical terms or intimidating you with hospital visits. She's about making sure people feel heard, understood, comfortable talking about their health. So the best thing is she'll keep it real, no awkwardness, no judgment, straight up to the answers. So without a further ado, let's get straight into the conversation.
So, hi, I'm Dr. Shweta, as Gayatri introduced me. I'm here in this field of women reproductive care. Now, since I'm dealing with women since so many years now, I'm not just only a reproductive expert, but sometimes I am their endocrinologist, sometimes I'm their psychologist, sometimes I'm just a friend, because women usually have a tendency to talk more. And like she said, that you all need someone to be heard about and not being judged. So I have to play those different roles in my entire career of being a gynecologist. I usually deal from all age group women, right from adolescence up till menopause and further. Not going into deeper details of me, but I usually I am an expert in this field, and women really like to, and this is what my patients have always told me, that I'm very easy to talk through, and I make things very simple. So without wasting time, let us start now. So today we are going to, can you just play this presentation? So, a very important question is, what is sexual health? Now, when we talk about health, there are three health talks that we mainly embrace into. First is the physical health, like बुखार है कि नहीं है, सर्दी है कि नहीं है, खांसी है कि नहीं. So that's your physical health. Now, up till now, since years, the mental health part was always ignored because people used to feel that if you're going to a psychiatrist or if you're going to consulting a therapist or a psychologist, you have some mental issue or you are some psychiatric patient. But since COVID, I think COVID has changed everything, and we have started getting a lot of mental health patients, a lot of mental health awareness things which are running around. People are being more aware of it. And the third part is a very important part, that is sexual health. Now, India, however we go ahead in all sectors, but I feel this sexual health is always taken as a taboo. So I have seen women like, educated girls. So like my family, I also come from a very conservative family, where during periods we are not allowed to go to temples, we are not allowed to touch things, 4 days we have to sit. But now, even in this generation, what I am seeing is there is no proper conditioning of the young girls. So they will always go and, whenever they have to talk about periods or whenever you talk about vagina, they will go and just whisper, or they will do some mumming here and there. I don't understand that if we as women will not respect our reproductive organs, how do we expect others to respect us? Like whenever I talk about breast, or whenever I talk about vagina, or whenever I talk about uterus, ovaries, more so on breast and vagina, I don't know, they will just go and whisper something in somebody's ear. We have to be very, very respectful to our organs, like our eyes, our ears, nose. So they are just organs of our body, and they need that due respect, and that has to start with us first. So we have to be very open about it, because they are our body parts. We need not go and whisper in somebody's ear. We can openly talk about it. We had a very recent movie on that, masturbation and all that, where it was very rightly told that we have to discuss, though they are private organs, but we can always talk about it in a right manner. Okay, so coming to that sexual health part, we have to understand that if our sexual health mainly is roaming is revolving around our hormones. So if our hormones are not good, our sexual health will not be good, and an indirect aspect of it is our mental health. So what do we when we talk of women's sexual health, we need to understand our reproductive organs first. Okay, so what does our reproductive organs include? We have breast, we have uterus, fallopian tubes, by the side we have ovaries and the vagina. Now all of these have two functions. One is the menstruating part and other is the sexual part. When we talk about menstruation, we all know that every month one egg is released from the ovary, that is known as ovulation. When this egg is being released, there are some chemical messengers which are sent from the brain, from the ovaries to the end organ, which is the uterus. Inside the uterus, it is the lining or the skin of the uterus that receives those signals. And if there is no conception, that egg is destroyed automatically by the body, and that lining sheds out as periods or menses. Now, the second function of these organs is the sexual function. Now, the sexual function is mainly because we have two important organs, the two important hormones, and these are the hormones which also play an important role in our menstruation. So we have estrogens and we have progesterones. Now, your first half of the cycle, that is from the day 1 of your period up till the day 14th, the main hormone is the estrogen. Now, this is the main female hormone, and apart from your menstrual function, this estrogen takes care of your hair, of your skin, of your breast, of your skin moisturizer, texture, your hair, your voice, your nails, majority, even your bones, and even your heart health. So estrogen is like the testosterone in males. Our main component is estrogen. Now, this estrogen is equally balanced by another partner, which is known as progesterone. Now, this progesterone and estrogen, they always keep on balancing each other in different phases of this month. Now, the next 14 days from the ovulation until we get our next period, the main hormone is progesterone. Now, the progesterone hormone basically takes care of your, again, your breast, your weight, your mood, and such other things are taken care by progesterone. Now, moving ahead, can you just take it ahead? So this is the basic of our hormonal health, our structural reproductive organs, and our functionality of the reproductive organs. Can you just take it ahead? So I just spoke about it. You can see the anatomy, the vagina, the cervix. The cervix is the mouth of the uterus. Then you have the uterus, the ovaries by the side, and the fallopian tubes. I've already told you the functions of each of them, and we'll move ahead. Can you just... So even we discussed the now coming mainly to these symptoms. Now, how do you identify or how do you decide whether your sexual health is normal or it is abnormal? So what are those symptoms? So whenever a woman engages or whenever she decides to engage into an act of sexual intercourse, the thought, just the thought, matlab she has not even engaged, only a thought of it should give pleasure. It should not be a painful thought. So there are some category of women who only with the thought, they have not even actually gone into the act, only the thought gives them goosebumps. So if anybody of you are struggling from this condition, this is medically known as vaginismus. I will discuss this ahead, but just keeping the term in mind that just the thought of getting into a sexual activity can also cause pain, and that is abnormal. So obviously there should be no pain, or you should not have any pain or any thought which disturbs you when you think about intercourse. Then there is loss of sexual drive. Then in that loss of sexual drive, you can have impaired arousal or inability to achieve orgasm. That all we will take further and talk further in the remaining discussion. Can you go ahead? Now, what are the other problems that you encounter? So there are some women who have difficulty in penetration. So the first act of intercourse is always painful because the vagina has a very thin film around it, and that ruptures, that can cause some pain at the initial act. So initial act, if you have a pain, that's okay. But if a woman is having pain throughout the act of intercourse, then it is abnormal, and it shouldn't be considered as normal as we are taught. It is abnormal, and she needs to consult a gynecologist. Then again, you have a disinterest, or you don't have that arousal, or you don't feel like. Then there are orgasmic disorders. Then you have some disorders which are pertaining to pregnancy and postpartum that we will discuss later. Next. Now, how do you diagnose them? First of all, because this is a very private thing, you yourself will take some time to, understand that there is some problem. Then a woman being a woman, she will first go and talk with her friends or whosoever she is comfortable with. She will confide. Then that woman will tell her something. Then thoda or time pass, and then she will go and search on Google. Now, to people search on Google. We have all Google fascinated patients. So then by the time she reaches to us, it is really very difficult, to make her understand, because there are so many things that are put in her mind from here and there. So I will advise that any woman who feels any of these symptoms or experiences any of these symptoms should definitely go to a gynecologist first, without wasting a minute of discussion with friends, with your siblings, or whosoever, with your peers, or doing some googling. That all should be later on. First is you need an expert to help you, to make you understand. I take a lot of seminars in college, in school going girls, so there I always tell them that before you are going to indulge into your first act of sexual intercourse, see, when you want to indulge is your choice. I am no one to judge, or I'm not no one to tell you the gyan on that. But before you indulge into any kind of sexual intercourse, you should have a first gynec visit to understand your reproductive organs, to understand their sexual functions and how do they behave, so that you people are not into some kind of a surprise when you go. You're already mentally prepared for it. So I advise all seminars, all school going girls, where I go in colleges, I always tell them that please take a consult, whether you're mature enough structurally as well as functionally to undergo an act of intercourse. That's the first thing. Blood test and all is a very later thing. First is you have to go to a gynac. A gynac will examine you. You have to talk to her regarding your fears, your concerns, what have you been, thinking about and all that. Because a lot of that now in this era there is so much information available, but you guys don't know what to accept, what to ignore. So it is always better to involve a expert. Next. Okay, now when you go to a gynac, now with all this, you have reached a gynac. Now, when you go to a gynac, you as a patient, what you should expect at your first gynac visit is very important. First of all, if you are anywhere in the age group of 21 to 65 years of age, or if you're all young between 21 to 30, 35, the first thing when you go to your gynac, you have to see your basic, she will check your basic weight, your vitals and all that, and then she will take you for an examination. Now, for the girls who are unmarried, who have never undergone an intercourse, we usually take their consent to do an internal checkup of their organs. And for those who are married, who are sexually active, we not need a consent. So a consent, a gynac will explain you that we are going to do an internal checkup, because your vagina is the outlet. So I'll give you a simple example. If I want to see deep inside your throat, I will have to depress your tongue. Then only I will be able to see inside the throat. Similarly, if I have to see your internal organs like your cervix, I have to depress your vagina. And for depressing that vagina, we have a speculum, and that might cause a little discomfort. It definitely doesn't cause pain. Women who are sexually active, who are married, in them it definitely doesn't cause pain, but for young girls, yes, it can cause. So we have to, first thing is, the gynac has to take a consent, has to explain you. Only after you give a consent we can touch you, otherwise till the time we can't even touch you. So that is the first thing you expect at a gynac's visit, is a per speculum examination, is what we call medically. Because when I depress your vagina, I would be able to see deeper into the vagina and the cervix. Now, why this is needed? As I told you, that in some women the vagina has a hymen. Sometimes that hymen might not have ruptured, it might be too tight, or it might be a hymen which is very tight. So when such women attempt the intercourse, it will be very painful for them. Nowadays, hymen gets ruptured by mild activities like running, jumping, cycling. And one more thing, it is no more a sign of virginity. We have, that concept is gone far away. That is another different topic altogether, which I might discuss, but it is no more a sign of virginity. Okay, so you have to get that checked, and then your vagina, whether your vagina is free of any infections, because again, as she spoke, she gave the number of sexually transmitted diseases. So that also I'm going to talk and cover. So for that, we have to check your vagina, and if you want to see deeper into the vagina, we have to do that per speculum examination. Then there is something known as a pap smear test. Now, all girls who are in the age group of 21 to 65 years, girls and women, and those who are sexually active, especially those who have multiple sexual partners, all of them have to undergo the screening test, which is known as pap smear. Now, what is a pap smear? It is a screening test for cervical cancer. Now, what is the cervix? Like we have a mouth here, we have a mouth down below the uterus, and like we have two lips, the upper and the lower lip, the cervix also has two lips. Now, that cervix, we in India, every third woman in the periphery. It is not more in metros because a lot of awareness, a lot of vaccinations, this prevention test. But when you go to periphery, every third or fourth woman is dying of cervical cancers because they don't have that much facilities that are available. So the cervix has this tendency of developing a cervical cancer, and out of the various causes, the most important cause that we have found out is a virus. It is known as human papilloma virus, or HPV. Now there is a big family of HPV, and all HPVs don't cause cervical cancer, first of all. Secondly, the HPV virus is an STD. It's a sexually transmitted disease or a sexually transmitted virus. So the only means by which the HPV can enter into our vagina, cervix is via sexual intercourse. Okay. Now, again, HPVs, all HPVs, as I told you, don't cause cancers. You have some low risk HPVs and you have some high risk HPVs. The low risk HPVs cause something known as genital warts. I will discuss what is that. It is also an STD. And the high risk ones cause cervical cancers. Now, any women who enters into an act of sexual intercourse, whether it is single partner or whether it is multiple partners, she will get infected with the HPV virus once in her lifetime. It's that common. Okay. But that does not mean that all women will get cancers or all women will get warts. Then why do certain women get and certain women don't get? So cancer, apart from the HPV, cancer has other multiple factors, like a patient who has never breastfed, a patient who has nully, who has never delivered, who is not maintaining good hygiene, some genetic factors. If she has a mother or anyone first degree relative suffering from breast, cervix, ovarian cancer, then she's at a high risk. Again, immunity, very important. The local immunity, the vaginal and the cervical immunity, that also plays a role when we come to the cancer diagnosis or a full-fledged cancers. So all women, in anybody, you take any sexually active women, she will be infected with HPV once in her lifetime. Now, depending on how her immunity is, how her family history is, how she's taking care of her local hygiene, that will decide whether she will go into the cancerous phase or she will be a normal woman. Now, when we talk about HPV viruses causing warts, now what are warts? So medically they are called as warts, but if you ask me in common language, like you see sometimes overgrowth happening on the skin. Have you seen small overgrowth? Sometimes people have these overgrowths which are happening, the tags, the skin tags on the tissue. So in the similar way, we can get vulval warts. Vulva is the external genitalia of the women. So there you can get warts. You can get warts on the labia, and you can get warts on vaginal and cervical region. And all these are caused by low risk HPVs. But once you have been infected with warts, that means you have a tendency of getting infected with high risk ones also, and these women have to be extremely careful. Okay. Now, what are the symptoms of warts? They usually have no symptoms. Usually when you will touch your lower area down, you will feel some bulb, some overgrowth or some bumpy, small bumpy things. They are painless and they usually come in groups. Okay. So they have no pain, they have no discharge, nothing. You will just feel some overgrowth or some swelling on your vulval region or in your labial region. But if you have internal warts like vaginal warts or cervical warts, that will be seen only when your gynac takes you for an internal checkup or a speculum examination. Without that, they cannot be seen. Okay. So this one thing I wanted to talk. And recently after COVID, we are seeing many young girls suffering from this warts. Now, what is the reason? Lot of these younger generation want to explore. So they just have one night relations with multiple partners. They just meet one night in some club and they are okay, they go ahead. See, again, I'm telling you when to be sexually active, not be sexually active, to have multiple partners, to have single partner, that is your personal choice. But my job over here is tell you to how to protect yourself from all these mishaps. So first is, whenever you are involving into sexual activity with any kind of known, unknown partner. However good that boy is with you, please do not trust anybody. You have to take your health, take charge of your own health. Nobody will disclose ever, even if they know that they have been infected with HPV viruses, they have gone to a doctor, they have taken treatment, and still they have virus inside them. Nobody is going to tell you. Let's be very, very clear about it. So then how do you take care of yourselves? So now we have invented vaccines against HPV viruses. If you all are aware of this or not, I don't know. We have vaccines against HPV viruses. We have 3 vaccines in the market. We have Gardasil, we have Gardasil 9, and we have Sarvavac. These are 3 vaccines which are available against HPV viruses. All girls in the age group of 9 years up till 45 years can take the vaccine. But I always tell that before the girl becomes sexually active, irrespective of her age, if she's already sexually active, no matter, again she can take the vaccine. But before she becomes sexually active, because even one act of intercourse will introduce HPV virus into your reproductive tract. So before you are becoming sexually active, if you take these vaccines, you already have soldiers sitting in your cervix and vagina to take care of the HPV virus, which will be entering when you become sexually active. So 3 vaccines, as I told you: Gardasil, Gardasil 9, and Sarvavac. Now, how do you select which one is better for you? So when you talk about only Gardasil, it takes care of 4 types of HPV viruses that cause warts. And the viruses that cause warts are different from the viruses that cause cervical cancer. Then you have Gardasil 9, which takes care of 9 types of HPV viruses, and these are mainly targeted on cervical cancer serotypes. And then you have Sarvavac, which again is an Indian brand. It is lesser expensive than the other 2 because the other 2 are from a multinational companies, so they are a little expensive. The Indian brand has just arrived. It is known as Sarvavac. So it protects you against 4 types of HPV viruses that cause cervical cancer, that cause warts. Okay. Now, dose is all girls in the age group of 9 years up till 45 years, but earlier the better. If you are taking the vaccine in the age group of 9 to 14 years, then you have to take only 2 doses. If you are taking after the age of 14 years up till 45 years, you have to take 3 doses. Now we have started vaccinating even boys. All boys in the age group of 9 to 11 years have to take these vaccines, because HPV virus not only causes cervical cancers, it also causes oral cancers, it causes warts, it causes penile cancers, anal cancers. So all those things which is involved in oral sex, in anal sex, and in penovaginal sex, all this where the HPV can enter, it takes care of all of these. And that is why we are also recommending boys to be vaccinated. For mothers who have just delivered, or who are planning fertility, or who are on their parenthood journey, I would advise them to complete the vaccination and then start the parenthood journey, because you have to wait 6 months from the last dose before planning of pregnancy. And those who have just delivered, you can take this vaccine in the breastfeeding period also, but it is must. Okay, so that was about your mainly. When we talk of STDs, we are now seeing this HPV virus is more common than HIV and all that. Okay. So when we talk of STD, people think that it is only HIV. No, STD has a big, big group. Commonly now we are seeing this HPV viruses, which are becoming very common. Secondly, what we are seeing in women is chlamydial infections and gonorrheal infections. Now, both of these, and there is something known as bacterial vaginosis. These are very commonly associated. So each of them have their own symptoms. So bacterial vaginosis, chlamydia, gonorrhea, all 3 of them, they have a very bad fishy odor of the discharge. So if you first, let me tell you what is normal discharge. Now, since we are covering discharge, now your vagina, like you produce saliva in the mouth, your vagina also produces 4 ml of discharge daily. It is its mechanism of self-cleaning itself. Okay. So if you are producing about 4 ml of discharge, which is non-foul smelling, which doesn't cause itching, which doesn't cause any urinary complaints like burning or anything, which doesn't cause any pain in the lower abdomen on and off, then that's a normal discharge. You need not do any treatment for it. One more thing I will tell you, which you girls must have commonly observed. Have you seen your panties getting discolored after certain type of use? And whenever you try to wash them, that the bleachy thing on the panty doesn't go. You must be changing n number of panties, but still every panty will have. So this indicates that your vaginal discharge is healthy, because your vagina is acidic in nature. Why God has made acidic? So that it cannot get infections from fungal, other organisms, parasites. So there is a natural protective mechanism in the vagina, so that makes the vagina acidic. And because of that acidic nature of that discharge, when it is exposed to air, it leaves that bleachiness on your panty. Means your vaginal discharge is healthy, and your vagina is extremely healthy organ. A woman who doesn't have this, there is some problem and she needs to go to a doctor. So this is your normal discharge. Now, what is an abnormal discharge? An abnormal discharge is the one which will stain your undergarments. You will have to use panty liners. That is that much of a discharge. And thirdly, it will have a very foul smell. If it doesn't have a foul smell, it will have itchiness, and it will cause burning while passing urine. Okay, so these are signs of an abnormal discharge. On and off pain in lower abdomen, which is unrelated to your periods, and that pain is not very severe, but there is some discomfort, you're not okay. So that is an abnormal vaginal discharge. Now there are different types of discharge. So if you have a fungal infection, that discharge will be like curdy white discharge. That will be like paneer or cottage cheese discharge. It will have no foul smell, but it will associate it with tremendous itching. So that needs treatment. Now, fungal infections are usually seen in young girls whose vaginal immunity is very low. Girls who are cleaning the vagina from inside. There are some women who have a habit of using a jet spray to clean the vagina from inside. Please don't do that. When you use any kind of liquid, water, soap, fragrances, perfumate products inside the vagina, the acidity of the vagina is gone, and then it starts attracting fungus, bacteria, and then you start getting repeated infections. So what happens when you go to a doctor, she will treat you, you will be fine. Again, when you start those habits, again the infection will come. So you will feel that the doctor's treatment is not okay every time I'm infecting, but this habit you have to leave. Don't clean your vagina. Don't put any water, don't put any soap inside the vagina where you have intercourse, where you put your menstrual cups. It is a self-cleaning organ. It doesn't need any cleanliness. That is one thing I want to really emphasize, because I have so many young girls doing that and they come to me with repeated infections. So stop doing that. If anybody of you are doing that, it's not needed. Secondly, fungal infections are very easy to treat. If we are taken care of properly, they don't recur. But if you leave the treatment in between, or if you don't take the treatment as your doctor's advice, it will recur, because fungus are known to recur. So you have to complete the course in as per the directions of your doctor. That is one thing. Now, when you have a very foul smelling discharge, foul smell means, have you ever experienced a fish van going nearby the smell? If you have that kind of an odor in your discharge, if your discharge is greenish or yellowish in color, and if you have pain on and off, not pain, but a discomfort in the lower abdomen, that is all this chlamydia. This is bacterial vaginosis, very commonly seen in young sexually active couples not using condoms and all this. This is very commonly seen. Again, this is very easy to treat. They'll give you a course of antibiotics. You need not worry. The worrisome part is HPV if you have warts, and second is HIV. Then you have something known as herpes also. Herpes is also an STD. You have two types of herpes viruses. There is one which affects above the umbilicus, and the other is which affects below the umbilicus. So you have herpes 2, which will usually infect you below the umbilicus. Now you have to understand that all viruses, let it be COVID, let it be HPV, let it be HSV, if your immunity is low, you will produce symptoms of viral infection. If your immunity is strong, in spite of you having that virus inside you, you will not have symptoms. You will be asymptomatic. Okay, so then how will you come to know about viral illness? So you have to, first thing is, if you want to protect yourself from any kind of viruses, you have to be very, 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 very careful of your immunity. Now, when I talk of this immunity term, in COVID, there was a lot of how to build immunity, how to build immunity. So your immunity can't be built overnight, first thing. Secondly, it depends on how good you are with your lifestyle. Now, when you talk about your lifestyle, main focus on three things: your diet, your sleep, and your exercise. And fourthly, your what other supplements you are taking, like your micronutrients, your other supplements which maintain your immunity, like vitamin C, like zinc. Overnight, nobody can build your immunity. It requires lot of effort. It requires lot of care that you need. You actually have to love yourself if you want to build your immunity. So when people ask me how to build immunity, I tell them you start loving yourself. You start focusing on your diet, you do mindful eating, mindful drinking, mindful exercises. All this will help in building your immunity. That is again a different lecture altogether, but I'm just trying to emphasize that all these things all together make up your immunity. Plus, everybody is genetically blessed with some immune factors. So if my genes are good, I have a very strong immunity. Even that plays a role. If you have inherited some bad genes which are not, they will, your immunity will be okay. So even genetic factors play a role in immunity, but they're uncontrollable. They're not in your hands. You cannot control them. You cannot modify them. So we will not discuss that. We will discuss the factors which we can modify to make our immunity better. So that I will take in the last if time persists, but that is very important. So all these things determine your immunity. So if you want to protect yourself from any kind of viral infection, let it be simple cough, cold, fever, then your immunity plays a very important role, because all these are viral illness. So that is another thing. That is why we have developed vaccines. What these vaccines do, they will actually boost your immune system to make more and more soldiers against that particular virus. So that is what your vaccines are doing. Okay. Then the other thing I was talking about was HSV. Now HSV2, that causes something known as genital herpes. Now genital herpes has no discharge, but have you seen chicken pox? In everybody in childhood must have suffered from chicken pox. तो बचपन का जो चिकन पॉक्स है उसको हम लोग चिकन पॉक्स बोलते हैं, और अडल्टहुड का जो सेक्सुअल ट्रांसमिशन से होता है उसको हम लोग हर्पीज बोलते हैं. Extremely painful condition. You won't be able to sit, you won't be able to do anything. Your entire focus will be there, and you will have fever, and they cause a lot of inflammation, a lot of pain. Again, you have to go to a doctor, get it diagnosed, get it treated. So that is herpes. Again, what I commonly see in young girls is something known as a Bartholin cyst. I don't know whether you all have heard about it. So like we have sweat glands in our axilla, we have certain glands which keep the vagina moist, which secrete this discharge. The normal discharge is secreted by glands which are there on either side of the vagina. There are two glands, that is known as Bartholin glands. Now those glands have an opening. Now when that opening is blocked, the secretions pent up inside the gland and it swells up and you have a small cyst. Now women usually come with complaints of they can neither walk, they can neither sit, it's extremely painful, she will have a fever. So this is Bartholin cyst. Again, it is caused because of the blockage of that duct, and that blockage may be because of any kind of infection. Even when women use these razors, when they rip off completely the hair follicles which are there on the vulval region, when you rip them off completely, that is the time you introduced some infection into the that region, and that is why you get this cyst. So I always tell all women that you are not supposed to rip the pelvic hair completely from the source, because that pelvic hairs have some function. What is their function? They maintain the moisture of your private parts. They prevent your private parts from any other kind of infection because of that little mobility they have. Then they keep the surface area good so that you don't attract infections. So when you rip them off completely, all that functions is gone and your external organs become more vulnerable to infections. So then what you should do, you can just trim that off. You just need to trim them off, because of when they grow long, all the bleeding that we have during periods, the other discharge and everything goes and sticks there. So you can just trim them off, but it's my genuine request, do not rip your pelvic hairs completely from your vulva. You will lose the maximum protection and maximum infection free area that it will give you. That is one thing, most common thing I wanted to discuss this. So that comes, we completed about the virus and the STDs mainly. HIV is like very rare. These are the more commoner ones that therefore I have discussed that, because HIV again is a very long topic that we can discuss later anytime. Now, when apart from STDs, what are the other common questions about sexual health that I want to emphasize on? Now, mostly women ask me whether IPIL is safe when you are not sure, or when you have not used any protection, or you had used a protection but it slipped off, it tore off, or whatever. Now, I'll tell you one thing, that IPIL, or the emergency contraception, which is medically called as emergency contraception, is only used in emergencies. Now, what is an emergency situation? You had an intercourse in your fertile window. There was no protection that was used. Thirdly, the protection that was used, either it slipped off or tore off, or you were not sure. So IPILs are the worst kind of contraception to be used. If you are using once in some emergency situations that I discussed, is okay. But if you are repeatedly using IPILs, please don't do that, because they are readily available without doctor's prescription. It has become a common practice to use IPIL. IPIL, most 95% of the times it will be very, very okay, but in some 5% of the women it causes a very grave complication, which is called as ecto. IPILs have a very high failure rate. So instead of taking IPILs, I have seen women who come to me with pregnancy and they want to terminate. Secondly, it causes something known as an ectopic pregnancy, means a pregnancy in the fallopian tube. So normally the pregnancy stays in the uterine cavity, which is normal. But when the pregnancy stays in the fallopian tube, it is abnormal, because the tube does not have that capacity to enlarge, because a pregnancy is a growing pregnancy like the uterus, and that tube will rupture and you will have tremendous bleeding, torrential bleeding into your abdominal cavity, and that can lead to death of a woman. It's a grave emergency. So I request all young girls not to take the regular IPILs as a regular contraception. If you are in your teens and you want to use a contraception, you should use condoms. You have male condoms and you have female condoms also now available. So they are available everywhere. So you can use both. I think both of them should use just as a double protection. It not only will prevent you against accidental pregnancies, but it is the only contraceptive method which will protect you against the STDs that we just discussed. So condom for teenagers is the best. If you are in the age group where you have already delivered one baby and still you are looking for a contraception, then you can go for a Copper-T, it's just an intrauterine device. You have to insert it into your uterus and forget it. And lastly, if you are in that menopausal age, then again you get one more device known as Marina, which will take care of your contraceptive needs in that part. So please, young girls, please use contraception. In fact, not only young girls, everybody who is not wanting further pregnancies, contraception, but for young girls, I'm emphasizing more, because it will protect them against sexually transmitted infections and diseases. Okay. Then I wanted to discuss about one more important medical term which I am seeing more commonly when I spoke about vaginismus. Now, what is vaginismus? Vaginismus is a condition where a woman, only with the thought, she has not even actually gone into the activity, it just brings anxiety into her. Secondly, when she gets into that act, she doesn't allow the partner to go further, because that she has that scare, that anxiety, she starts getting palpitation, she will become full sweaty, she will push the partner. In severe cases I have seen, she pushes the partner. That is the time they come to know that it is something abnormal. Okay, so most of the times vaginismus is diagnosed by the couple or by the woman when she goes into the act and she doesn't allow like any other normal women. So this is known as vaginismus. Now, why this happens is, so normally we have our vagina. From the vagina, there are some nerve endings which take the message to the brain. Now, in the brain, we have a pleasure center. So, whenever any normal woman who goes into the act of sexual intercourse, what happens is, first of all, first thing when you all go into the act, if you have noticed, there will be a lot of discharge. Okay. Now that discharge will send message to the brain and it will activate the pleasure center in the brain, and in return that pleasure center will send some chemicals that I just spoke, estrogen, progesterone. There are some other chemicals. In the form of those chemicals, the signals will be sent to the vagina, and the vagina will open. The muscles around the vagina will relax and the vagina will open. Vagina is an elastic organ. Okay. The entire baby, a human baby of about 2.5 to 2.8 kg, delivers through that vagina. So you can imagine how elastic it is. So it's the only organ which is very elastic. So your muscles around the vagina, they relax and the vaginal opening expands to accommodate the penis. Now, in a woman who has vaginismus, what she does is her mind tricks. So because she always thinks that it is painful, it is painful, it is painful, the pleasure center in the brain shuts. Because it shuts, it starts releasing some chemical messengers which will cause that vaginal muscles below to contract. Once they contract, the vaginal opening diameter reduces, and when the partner attempts, she has that feeling that it will cause pain. It actually doesn't cause pain. So structurally, there is no problem in the women's vagina or the reproductive tract. The problem is here. Now, this actually is, there is no cause for it, or sometimes when the woman has heard a lot of bad stories from her friends, from her peers, कि मेरे साथ ऐसा हुआ था तो मुझे बहुत पेन हुआ था, or some bad porn that she has seen. Now, one thing you'll have to realize that porn, whatever they show, however bad, however good it is just all scripted. And in real life, sex is not this. You can't see a porn and practice that in your real life. It's not possible. So fascination and all is a different thing, but to practice that in your real life is not possible, because that is not how real sex is. Real sex is pleasurable to both the partners. Both the partners should achieve their orgasm because it's need of body. It is body need. Like your eyes have some function, your nose have some function, your ears. So your reproductive organs, functions, requirements, bodily needs are being fulfilled. So there is nothing wrong in intercourse or all that, but the way of doing it, it should not harass the other partner. It should be it should be painless, and it should be pleasurable to both of y'all, which is a proper healthy sex. Otherwise, either of them have some problem, and you have to get that sorted. You can't ignore कि हाँ ऐसा ही होता है, ऐसा ही होता है, ऐसा ही चलता है, initial ऐसा रहता है. No, even the initial act of intercourse, I'll tell you why. Because only at the entrance of the vagina you have those nerves which will cause that activation of the pleasure center in the brain. Once the penis is inside the vagina, it's like a blind hollow tube. There are no nerve endings, so you should not feel pain at all. In fact, the pleasure part should be more and the pain is absolute zero. Okay, so it is only at the penetration that you might feel pain, but after the act you should not feel pain. In fact, you should not be in the correct senses to identify pain, because you are into that orgasmic part. It might be small for some women, it might be long for another. That is a different story. But once the penis is inside the vagina, there should be no pain because it has no nerve endings. That's the first thing. So that has to be kept in mind for all women. Actual, real, healthy sex is painless. Okay. Now I have covered STDs. I have covered this. We can just move ahead. I think I can stop here, and if anybody has questions, please feel free to ask. I think this was the important things that I wanted to cover. And anybody, any questions, you all can ask.
Yeah, there are a few questions in the chat
Yes.
box.
I'll
I'll read through.
yes.
So, first question is, what are the symptoms of HPV virus?
So I told you, HPV usually is asymptomatic. It has no symptoms. It will either, so suppose you have warts. So what the incubation period is very long. So suppose you have been infected with HPV virus today, 3 months down the line, you will see those small bumpy regions on your labia, on your vulva. It has no symptoms. When you are washing, you will touch something and you will feel. So that is a symptom of warts. Cancer, suppose you have been infected with HPV, a high risk HPV virus right now. 30 years later, the 30-40 years later, she will have complaints like postmenopausal bleeding. She will have complaints like pus coming out from the vagina. She will have symptoms like severe pain, then that are all cancer symptoms. So that because of an incubation period being very long and mostly they are asymptomatic, that is why we advise all women to protect themselves with this vaccine, because it is very difficult to tell the symptoms. It has no symptoms.
Okay, I'll read out the other question. What about V wash or clean and dry? They're made out for the particular purpose only.
So,
So
so this V wash, clean and dry, whatever it is for your external hairy portion. It is for the vulva. Nothing inside. I'm talking about the vagina, which is a hollow tube. You have to insert your finger inside to see the vagina. Vulval washes is okay, but there are some women who are using jet sprays inside that vaginal opening, is what I'm trying to tell you. Where you insert menstrual cups, where you have intercourse, you have to insert your finger and clean it inside. External, no problem.
the other question is, please tell us the complete procedure of getting HPV vaccine.
So the complete procedure of HPV vaccine is you have to visit your nearby gynecologist, and she will tell you that there are like I told you, there are three vaccines available. You have Gardasil, you have Gardasil 9, and you have Sarvavac. The first two that I told you, they are a little expensive because they are coming, they are from abroad, and the Indian brand is known as Sarvavac. And now in the parliament, they are going to pass a bill where these vaccines will be available in all government hospitals free of cost. I think Sudha Murthy has raised that query. And I think there is some work going on that because we are seeing a lot of peripheral women who are not getting advantage of these vaccines. All metro people and everybody are taking the vaccine. So for them, they are going to make it freely available in all government hospitals free of cost. Anywhere it is available, you have to just go to a gynac, she will explain.
Okay, so for people who are asking, will the recording be available? Yeah, we will upload it on YouTube. So you can
See,
go.
if you want, you can. I have my social channels, social handles where I do a lot of advocate on a lot of women health, very very rare topic which nobody wants to talk about. I've openly spoken on my Instagram and on my YouTube channels. I will share. You can just follow and you can see those videos.
So like there are a lot of questions. I have a
There will
question.
be.
I have a question that if we have had sex before and there's a gap of a few years, and if we are having sex after marriage, does it get known?
Yes. So known in the sense, if you are repeatedly involving in sexual activity before marriage, then your vagina loses its elasticity and it becomes a little loose. After marriage, repeatedly means the frequency is very high, and it is a very rough one, like it is shown in porn and all that. Then the vaginal introitus becomes loose. And if your partner is smart enough, or when the vaginal opening is a little tight, the pleasure is more, and when it is a little loose, the pleasure is not that much, because the diameter is already loosened, and when you have intercourse, it loosens further. So that if your partner is smart enough, you can come to know. So that is why women are opting for something known as cosmetic gynecology, where we do tightening of this vaginal opening and things like that, so that their post marriage, their life is not disturbed.
Okay. PMS and early
Yeah,
pregnancy
again, a
symptoms.
very big topic. This premenstrual syndrome or premenstrual symptoms. Now, again, as I explained you, two main hormones are the culprit of this. You have estrogen and you have progesterone. First 14 days estrogen, next 14 days is progesterone. Now, because of a lot of fluctuations in these hormones in the entire menstrual cycle or in the entire month, you have these PMS. Most of those PMS happen because of the progesterone hormone that is to be blamed. So you have breast tenderness, you have bloating, you have some people experience 1-2 kg weight gain before periods, mood swings. All this is because of lot of fluctuations in the levels of these hormones. Now you can't get away with these fluctuations, but what we can do is, if you have a habit of exercising daily, not only in those 4-5 days, if you are a proper chronic exercising, if you have something known as black chocolates, dark chocolates, because those dark chocolates have something known as serotonin, which will cause your brain to calm down, that will also help. Exercising, and mainly exercise helps a lot for PMS. Dark chocolates, again, rich in magnesium, rich in serotonin, which will give you that feel good factor to prevent. But there is no woman who can get away with these mood swings. In spite of that, you might have some. When it is very severe, then we give hormonal treatment. Otherwise, we tell them to manage with this only. Exercise really helps in controlling this premenstrual syndrome.
Is HPV vaccination painful?
No, it's like a normal COVID vaccine, like how we all have taken COVID vaccines, like that.
And the other question is it normal to bleed for 1 to 2 days after intercourse? And even periods are for 3 to 4 days only, with third and fourth day being insignificant bleeding.
So for this, I think, see, any women, I will first tell you what is the normal pattern of your menstrual cycle. Any cycle which is from 24 days up till 35 days is normal. Any bleeding which lasts between 2 to 7 days is normal. Anything which is less than 2 and more than 7 is abnormal. Please visit your gynecologist, get yourself tested. And any cycle which is less than 24 days and more than 35 days is abnormal. Please consult. These are the normal ranges that I have given you. Please see a gynecologist.
The other question is my mother has herpes on lips. Is this because of STD? Doctors did not mention STD.
So I told you, above the umbilicus is non-STD. Below the umbilicus, so lip herpes is caused by HSV1, and HSV1 is not transmitted sexually. It is the HSV2 which is transmitted sexually.
The other question is my vagina is loose. What is the solution?
No, you can't decide. Your gynecologist has to check, and she will decide whether it is loose or tight, and we have procedures for tightening the vagina. Again, it depends on your age, whether you have born a child or not, and all those things. So your doctor will decide. You will not decide whether it is loose or not.
How do you treat hormonal imbalance?
So first of all, you have to find the cause of hormonal imbalance. It is because of PCOD, it is because of obesity, it is because of some other stress issue. What is the cause? And then you have to treat it accordingly.
The other question is one inward and another outward nipple in one body. Is it normal?
So yeah, you can have difference. That is, the inward nipple is known as a retracted nipple. If it is by birth, it is like that, and as you have grown, it is like that, means you are born with it. But initially, if it was normal and then it has retracted in, then we have to check the cause, whether there is any swelling in the breast or there is what are the signs. Again, it depends on the age of the women, at what age she has this. Please go to your doctor, nearby gynecologist, get it tested. If she says it's normal, you need not worry. But this has to be seen by a doctor.
The other question is can one get HPV vaccination if planning for pregnancy?
So actually it is safe, but we advise that you have to wait for a period of 6 months from the last dose of the vaccine. So after you have taken the last dose, wait for 6 months and then start planning.
The question on PMS and period was, I think, misunderstood. There's
Was
someone.
it is very difficult to differentiate between PMS and early pregnancy symptoms because they are more or less similar. Nausea, vomiting, drowsiness, feeling of tiredness, mood swings. It's very difficult. We cannot differentiate. The only thing which will help is if you have gone beyond your period date. Beyond means how many days beyond? More than 7 days if your periods are delayed from the expected date. Please check on the Prega News kit test. That will be the first test to come as positive or negative. If it is a single line, it is negative. If there are two lines, it is positive. After that, after 7 days from that, once you get that Prega News kit test positive, 7 days from that time, you have to do a blood test that will come positive, means you are pregnant. If the value is more than 2, you are pregnant. If it's less than 2, you are non-pregnant. And सबसे last हमको sonography में समझ में आता है. But initially, early pregnancy symptoms and PMS symptoms are very similar. It is very, very difficult to find out. We usually ask the women whether she has got her periods or she has not got her periods. If she says she has missed her periods, the first thing is we tell her to do the home kit test. If that home kit test is not conclusive, then we do the blood beta HCG.
My mother is diagnosed with HPV 16, and after MRI, her biopsy sample is sent. So, what should we do further? What is the severity of it?
If her HPV 16 is positive, HPV 16 again, 6, it comes in the high risk HPV. You have to see the biopsy sample, what is the report, see the MRI, and then you should proceed further. Sometimes these early changes, if there are there, it shows only early cancer, like a cancer which is there only till the cervix, like a CIN or something. And if it comes out to be a low grade, then you need not worry. But if it comes out to be high grade, then you have to get all the other further procedures done. Consult a gynecologist for sure.
So, if there's no pain during periods, is this a problem?
No, it's not a problem. Yes, spotting before periods is normal. No painless periods is also normal. So, a period, so normally you have two types of periods. You have ovulatory periods and you have anovulatory periods. Ovulatory means the egg release process is happening properly. So when the egg release process happens properly, there are some chemicals released which are known as prostaglandins, and these prostaglandins cause pain. If you have painless periods, then mostly your cycles are anovulatory, means the egg release process has not occurred, therefore the prostaglandins have not released, and therefore there will be no pain. If you're in your teens or something, it's okay. But if you're planning for pregnancy and if you have painless cycles, means the egg release process is not happening properly, and that is why you are not conceiving. So you may need to make those anovulatory cycles into ovulation. Now it depends upon the cause of anovulation. Your doctor will find out the cause, treat it, and then everything will be fine. Spotting before periods is normal.
Can
Now,
you
menopause, again, it's a very, very difficult phase for a woman. So it's a very big and long phase. Basically, it starts from the age of 40 years. So before the age of 40 years, your body was young, your body was ready for pregnancy. Once you hit 40, you go into the transition. That is from the reproductive, you are going into the menopause. That phase is known as perimenopause. Okay. Here, what happens is, I told you, the main hormone, the main female hormone, that is estrogen, goes low. Because up till now, your body was used to high levels of estrogen. Now the estrogen has gone low, so your body starts showing withdrawal. So what withdrawal? You will have mood swings, you will have hot flushes, you will have dry and brittle hair, your breast will regress, periods will stop, weight gain will happen. Then other issues like thyroid dysfunction, diabetes, lipid profile derangement, all that starts creeping in. Now everybody doesn't undergo through all this. So this phase, all women have to do particular checks. So after 40 years, I advise all women to do a pap smear once every 3 years up till the age of 65 years, a breast sonography yearly, a breast mammography yearly. Her hemoglobin, thyroid, sugars, lipid profile, vitamin D, calcium, vitamin B12 yearly has to be checked. And once in a year, a sonography and visit to a gynecologist till she reaches a phase where there are no periods for a period of 1 year. Means she has attained menopause. And when a woman is going through menopause, her diet also is a different diet. You have to visit a gynecologist, get all that confirmed. And she has to avoid all triggering factors like alcohol, too much of caffeine, smoking, spicy food, because they get that hot flushes. And I tell all menopausal women to have 3 seeds: sunflower, flax seeds, and apna black sesame. You can mix all of them, dry roast, and they have to chew. The logic is to chew them. Don't make juice, powder, anything. Those seeds have to be chewed. When you chew them and when they mix with the saliva, they contain certain chemicals which are very identical to the natural estrogen in the body. Therefore, the body feels that feel good factor. It feels that that estrogen is coming back, and that is why they can allay those symptoms for some time. This is temporary, but you should. And all women should start on vitamin D, calcium supplements in their menopause, that your gynec will tell you. So fibroids, again, fibroids grow from the muscle layer of the uterus, like we have muscles in our hands. They are growth from the muscle layer of the uterus. Extremely women friendly, never ever cause cancer or anything. They do not go away on their own. The only treatment for fibroid is surgery, but we prescribe a surgery only when the woman has complaints like heavy bleeding during periods, lot of pain during periods, she's planning to pregnancy and she's not able to conceive. So again, fibroids is a big topic, needs another session for sure. How long does it take for? So any couple who has, it depends upon, first of all, the age of the women. If the women's age is less than 35 years, married life is less than 5 years, then any couple who is trying actively for a period of 1 year, active trying means having relations every 72 hours without any contraception, and with the and if this trying has to be done for a period of 1 year. In spite of that, if they don't conceive, then you have to go to the doctor. But if the women's age is more than 35 years and the waiting period is not 1 year, if they don't conceive within 6 months of active trying, they have to go to a doctor. So this lump in the underarm sometimes can be an axillary tail. So breast has an axillary tail. It could be that. You will have to get yourself evaluated. A doctor has to see you. I don't know who has seen you. That is, if it's just an axillary tail of breast, nothing has to be done. But without seeing, I cannot tell you anything. Is pap smear test painful? Not painful, but it causes some amount of discomfort for sure. You can use water-based. So while you are trying to conceive, I will advise you not to use any kind of lubricants, but water-based lubricants are safe if the couple is having difficulty while having intercourse. In fact, I tell all couples to involve into a lot of foreplay, so that touching your important points like your lips, your nipples, your armpits, umbilicus, navel, labial, clitoris, all those are the very soft points. If you touch, if you stimulate them, you will have a natural surge in the natural secretions of your vagina, which is a very good medium for the sperm, and it will also cause less friction via intercourse. So don't directly jump to the the intercoital activity. Involve in a lot of foreplay that will cause natural release of these natural discharges, which will help you in conception. All lubricants, all whether it is water based, are okay when you're conceiving, but avoid them is what I would say. Sometimes that also can be a cause of not conceiving. Yes, pre-pregnancy consultation is a mandatory thing. You have to take only folic acid when you are trying to conceive. You have to maintain an optimum weight, both the partners, depending upon your height. And you have to avoid alcohol, smoke, all that, hookah, weed while you are conceiving. That's it.
I think we're done with the questions.
No more questions?
No more questions, I think.
Okay, I think I have to start my OPD also. My patients are waiting out. It was nice, interacting with all of you, and a lot of questions were asked. I always like such interactive sessions. I don't like sessions where, I'm only speaking, because it's not a school. We are talking about very practical things that we all women face day to day life. So I think the more you'll ask, the more you'll come to know, and any kind of such sessions will be very small. You can all follow me on my social profile, Dr. Shweta.social on Instagram, Facebook, YouTube, where I have a lot of such videos that I have uploaded, which might help you. Because nowadays there is so much information. Everybody is trying to be a health influencer. Everybody is trying to be this. Everybody is trying to be that, without the basic qualification. So always, when it comes from a qualified person, that will always help you.
A huge thank you to you, Dr. Shweta,
Thank
for
you so
breaking it all down, answering our questions, and making this space safe and stigma free.
much.
And
Yes.
of course, thank you to all who have been present here for being part of our Wellness
Yes.
Wednesday webinar.
Yeah.
There's one thing we're taking away from this. It's that our health, our sexual and reproductive well-being deserves attention, respect, and open conversations. No more like brushing things under the rug. No more suffering in silence. So to all the women out there, happy Women's Day. May
Yes.
we
Happy
continue
Women's
to us
Day.
like
Happy and a healthy Women's Day. Apart from happy, we have a healthy Women's Day.
yeah,
Because until and unless we are healthy, our family will never be healthy because we are the main pillars of our family.
yeah. So, if you want to stay updated on future sessions and get more insights on health and wellness, you can follow us on our social media pages. To learn more about how we support you all through health journey, like you can visit us on www.onsurety.com. So, we'll see you next time. Until then,
Thank you. Bye. Take care.
thank you. Thank you, everyone.